So, Dr. Pearce, David Pearce, in medicine and scientific research, we all go to a number of these different conferences and meetings and so forth, and they tend to be sort of one-dimensional or pretty well focused. Why do you think this type of Vatican conference is important? What's the benefit of having this type of interaction?
Yeah, I mean, science, and I think COVID has taught us even more, is becoming much more of a global phenomena, much more of a collaborative area. And it's team science, it's team research. It's really something where you need to work together. So a meeting like this brings together individuals that are working on different areas. Where you can learn from each other. And again, COVID is the perfect example. I mean, pulmonologists and infectious disease and hospitalists are all working together right now to save the lives of individuals. Institutions like ourselves, will have that expertise, but we never brought it together in that way before. And at the Vatican meeting, is what this meeting does is bring people who are in regenerative medicine, hematology and oncology, infectious disease, and shares those ideas. So it's just really good to bring those different, what I call interdisciplinary approaches together.
Absolutely. So as long as you mention these sorts of interdisciplinary interactions and collaboration, Sanford Research is known for worldwide for introducing sort of these new treatments to patients for disorders from cancer to rare diseases and accelerating it from the bench to the bedside, getting it out of the lab and actually getting it into the clinic. What are some of the key learnings here that you've been able to come up with as you've done this to help change our healthcare system for the better?
Yeah, I think it's a model that others will follow, that a health system can have a research arm that's truly integrated into it. The fact that we have our research staff embedded within the clinics and within the hospitals. So if someone shows up and we think there's a clinical trial that we have open that they'll be eligible for, we can immediately get them into that. That's not rescheduling an appointment to come in the following week. And then our bench science is all about going from that bench to the bedside. And I'm just so proud of some of our scientists, over the growth of Sanford research in the last 10 years that have, transcended and really introduced gene therapy, regenerative medicine, and just recently another one where we a clinical trial that was designed that came out of the mouse models here from Sanford is now being completed and saving the lives of individuals.
It's fabulous. So as you've done these collaborations to improve patient outcomes, which is of course the bottom line, data is what's important here. So you can really understand whether it's real evidence-based medicine, essentially. What role does then data and technology play in this patient-centric care model that you're talking about?
I think it's incredibly important. My background in rare diseases is that we may have a handful of children across the United States, and their electronic medical records where they've been followed through the course of their disease over a period of time needs to be pulled together from those different systems. COVID, again, with a registry now that we have of the 100,000 patients in our system that have had COVID, we've used that to create an algorithm so we knew who to give the vaccine to first. We knew who to call within 24 hours of diagnosis to do the infusions of the monoclonal antibody therapies. The electronic medical record and understanding what we have in there is going to be more and more important as we get to understand and as artificial intelligence is developed to really expedite our understanding of pulling the answers out from that data.
It used to be all gut feeling and hunches and that sort of a thing, and now we can really rely on real data to figure these things out.
Absolutely.